I was tagged on this video by a user at Birthify Official. There were 3 particular statements or claims that were made by this user in that video, and I want to address them, aka fact check them. The first thing they say is, when people choose to have a cesarean, it's rare, if ever, for families to be given the long-term risks of a cesarean. Now, it seems they are talking about a cesarean section on maternal request, which means an individual has chosen or chooses to have a cesarean section in the absence of any medical indication. There's no reason to have the cesarean other than they just want a cesarean, which, according to ACOG, we can honor and should honor if the patient decides to do that and still wants to do it after a discussion of the risks and the benefits. And that does include a discussion on the long-term risks. Point number 2 they make. We know that induction doubles the risk of having a cesarean. Let's discuss this ACOG obstetric care consensus, safe prevention of the primary cesarean delivery. First thing they say, studies that compare induction of labor to its actual alternative, expectant management, awaiting spontaneous labor, have found either no difference or a decreased risk of cesarean delivery among women who are induced. This appears to be true even for women with an unfavorable cervix. They go on to say, a meta-analysis of prospective randomized controlled trials conducted at less than 42 weeks of gestation found that women who underwent induction of labor had a lower rate of cesarean delivery compared to those who received expectant management. Or how about this article, Induction of Labor and Cesarean Section? This article does address the downsides of induction of labor, but they say, however, of the many downsides of induction of labor, increasing the cesarean section rate is not one. Cesarean section rate should not feature in the risk-benefit analysis of induction of labor. And what about this New England Journal of Medicine article, Randomized Trial of Labor Induction in Women 35 years of age and older? Among women of advanced maternal age, induction of labor at 39 weeks of gestation, as compared with expectant management, had no significant effect on the rate of cesarean section and no adverse short-term effects on maternal or neonatal outcomes. And that's just a few of the articles. Induction of labor does not double the risk of having a cesarean section. It does not. That is wrong. The final thing they talk about are the long-term effects of having a cesarean section. But the resource they used, unfortunately, came from a law firm's malpractice website. And this is what that website says. Children born by C-section also suffer increased rates of diseases, including asthma, type 1 diabetes, allergies, obesity, as well as reduced overall cognitive functioning and lower academic performance. Are there studies that are looking at those long-term effects of cesarean? Yes. Are there studies that say there is an association? Yes. Are there studies that say there is a causation? No. And that's because these studies are not the best designed studies, nor are they powered to make that kind of determination. And there are multiple studies that show that there is not an increased risk of having those long-term effects with cesarean section.